Next speaker is Dr. Yuki Sato. Please.
Hello, my name is Yuki Sato from Saga University in Japan. I appreciate to have this opportunity to share some recent knowledge with you. Airway diseases such as allergic rhinitis, obstructive sleep apnea, and asthma are common and frequently coexist. The reasons for this relationship have not been clearly demonstrated. However, several mechanisms for the one airway have been postulated: involvement, common inflammatory and neurologic pathways. If these diseases are present together, it may be more difficult to treat one without appropriately managing the others. There are many reports on the relationship between these diseases and oxidative stress. Today, we will focus on allergic rhinitis and asthma and show you about involvement of oxidative stress, and finally, we briefly introduce about our recent research. Allergic rhinitis is a common condition that occurs when the body has an allergic reaction to allergens in the air. It's caused by the body releasing histamine in response to allergens like dust, pollen, mold, or pet dander. As I mentioned previously, allergic rhinitis may be associated with other diseases such as asthma, sleep problems, sinus and ear problems, cough, and more. Allergic rhinitis has been reported in 5 to 50% of the population. Especially in Japan, 50% of the population have allergic rhinitis, so it's one of the social issues. In allergic rhinitis, histamine causes swelling, itching, fluid to build up in the nasal passages, sinuses, and eyelids. Allergic rhinitis is classified according to duration, intermittent or persistent, and severity, mild, moderate, and severe. Allergic rhinitis can affect quality of life, like interrupt sleep, cost money, missing work or school, or not functioning as well at work. Research suggests that treating allergic rhinitis helps improve overall quality of life and sleep. We diagnose allergic rhinitis by conducting history and physical exam. Here is a patient, allergic rhinitis, and left nasal cavity. His inferior turbinate is swollen and discharge is watery and clear. To investigate allergens, we conduct skin prick testing, serum selective IgE antibodies, and nasal provocation testing. It's for local allergic rhinitis. This is a simplified figure for treatment of allergic rhinitis. People may avoid their allergens if there is these things can easily avoid it. Using oral antihistamines, glutathione receptor antagonists, and intranasal steroid corticosteroids can help control their symptoms. Immunotherapy is a treatment that introduces to the body antigen to the body in a small amount at first, and the body will not react to the allergen. There is also biologics and surgeries to improve the symptoms, but we cannot cure completely, and we sometimes feel it difficult to control this disease. Next, about asthma. Asthma is chronic inflammatory disease of the airways that causes airway hyperresponsiveness, mucosal edema, and mucus production. Histamine increases airway smooth muscle mass. There is increased vagal tone and airway smooth muscle cell contractility. Symptoms of asthma are cough, wheezes, sputum, difficulty breathing, chesting, tightness, and more. Status asthmaticus is a medical emergency, and so physicians, it's important for physicians to keep asthma at a good control level. Using spirometry, physicians can diagnose asthma and the severity of obstruction. If spirometry is normal, testing with methacholine is conducted. Methacholine is a muscarinic agonist and can determine the severity of bronchoconstriction. They also check chest X-ray or CT. Allergen testing is not useful in diagnosing asthma, but it can help identify certain triggers that worsen it. There are several approaches for treatment of asthma. Allergen avoidance is similar with allergic rhinitis. Inhaler is most common as a bronchodilator. There is 3 types of inhaler containing steroids, beta antagonists, and muscarinic antagonists, and physicians will select for individuals. Glutathione receptor antagonists, theophylline, and oral steroid use can help control the symptoms. In severe asthma, biologics are used. There is a surgery that uses gentle heat to shrink smooth muscles, but it's not common. Next, this figure shows pathophysiology of allergic rhinitis. In sensitization phase, allergens are taken up by dendritic cells in the nasal epithelium, and Th2 cells release IL-4 and IL-13. Then, B cells produce allergen-specific IgE antibody. Subsequent allergen exposure activates mast cells, release various chemical mediators such as histamine, leukotrienes, prostaglandin, and more. And then immediate reaction is induced, like sneeze, itch, run, and blockage. After that, IL-5 induce late phase reaction by eosinophils, like blockage, hyperreactivity, and hyposmia. And now, we pay attention to periostin induced by IL-4 or IL-13. Next, asthma. In asthma, there is two phases, early phase and late phase. The early phase is initiated by IgE antibodies that are sensitized and released by plasma cells. IgE antibodies then bind to high affinity mast cells and basophils. When a pollutant or risk factor gets inhaled, IgE antibodies release many cytokines, and Th2 and Th1 cytokines induce inflammation of smooth muscles. IL-13 is involved in remodeling, fibrosis, and hyperplasia. Within the next several hours, the late phase occurs, in which eosinophils, basophils, and neutrophils perform bronchoconstriction. Pathophysiology of asthma and allergic rhinitis is not same, but as you know, the pathway is almost materials of this pathway is almost in common. And these cytokines also induce expression of periostin. So what's periostin? Periostin is an extracellular matrix protein belonging to the fasciculin and integrin family. It's highly expressed in chronic inflammatory diseases such as asthma, atopic dermatitis, eosinophilic chronic sinusitis or chronic rhinosinusitis with nasal polyp, and allergic conjunctivitis. IL-4 and IL-13 signature type 2 cytokines can induce periostin expression, and now it's receiving much attention as a biomarker for inflammatory diseases. In allergic rhinitis, oxidative stress disrupt epithelial cell barrier integrity and affect allergic pathway. Researchers have reported effects of antioxidant for allergic rhinitis, but due to its complexity and multifactorial components in allergic rhinitis, the reason for this relationship between rhinitis and oxidative stress has not fully understood. In asthma, when high levels of oxidative stimuli are present, additional sets of intracellular signaling cascades are triggered, which lead to the expression of inflammatory cytokines. And IL-13 was found to be necessary for airway hyperreactivity and goblet cell metaplasia. So we will show you about potential involvement of oxidative stress and periostin. In allergic respiratory diseases, as I mentioned previously, expression of periostin is induced by IL-4 or IL-13. And periostin worsens inflammation of these diseases. Regarding oxidative stress, increased permeability of mucosa and inflammation worsen these diseases. These relationships interact has known well, but it's not known whether periostin affects oxidative stress And conversely, oxidative stress affects periostin. Next, we will show you about our ongoing study. We can demonstrate involvement of periostin in allergic respiratory diseases by using periostin knockout mice, comparing allergic reaction under the periostin and without periostin. And there is no periostin, allergic respiratory diseases will be improved. Regarding oxidative stress, antioxidants can improve allergic respiratory diseases, and it may reduce periostin, expression of periostin. And we cannot demonstrate interrelationship and periostin and oxidative stress without allergic pathway, but it may be a useful approach. This slide shows the goals of our research. The studies have shown that anti-periostin antibody improved atopic dermatitis mice model significantly. This approach may be useful for allergic respiratory diseases. And furthermore, if there is a relationship between periostin and oxidative stress, it may become a key point and new approach for allergic respiratory diseases by using anti-periostin and antioxidant supplement 20x for combination. This is my last slide. We collaborate on a study with other departments and research centers using allergic models and periostin knockout mice of Izhara Labo. We take samples and evaluate behaviors and pathophysiological pathway of them. And we ask measuring and analyzing of our samples for Gifu University and Louis Pasteur Center. We hope that our research will provide a new approach of allergic diseases in the future. Thank you for your attention.
Thank you very much for the presentation. Is there any question or comment on the floor? Okay, thank you very much. ありがとうございます。